Well, a new virtual care platform is hoping to change the way women going through menopause and perimenopause receive care. Blair Health is an AI-powered healthcare app that assesses the stage of menopause a woman is at by using information that is shared by the user. It then creates a personalized care plan. Here to tell us more about the app, how it hopes to change healthcare for women, are co-founders of Blair Health, Madge Ruman and Dr. Lindsay Sheriff. Good to have you both here.
Thank you for having us.
Thank you.
First of all, and who wants to take this one? How does the platform work?
Yeah, absolutely. I can take that one. So the platform is very easy to use. So what you do is you create a login. It only takes a couple of seconds. You complete the menopause assessment, which is going to give you an instant diagnosis about the stage of menopause that you are in. Then you complete a more comprehensive health and wellness assessment. And our system takes both of those inputs and it automatically generates a treatment plan for you that is personalized and evidence-based. And then you have the opportunity to navigate through the app and learn more about menopause and connect with a community of women.
When people hear AI, one of the concerns is that one of the things AI does is it grabs information from that's out there and sort of condenses it down. So if there are concerns from people that, there's a lot of misinformation about menopause and perimenopause out there, how do you answer that question for them?
Yeah, absolutely. Such a good question. So we have a lot of safeguards on our platform. Our closed loop AI has many medical rules behind our models that are based on clinical practice guidelines. Furthermore, we ensure that patients see a provider on our platform before they get any kind of a treatment. So we have human controls in place that can make any corrections if needed. But our platform has been clinically validated. It's completely safe. And we also take the back end, the workflow, and operationalize it on the provider's end so that the provider is able to spend much more time speaking with the patient and not getting bogged down in history collecting details.
But part of the reason that you both created this app is because there's a real gap in information for menopausal women or women experiencing perimenopause. So how are you hoping that using this piece of technology, this digital side of healthcare, will help?
Yeah, so it's really all about leveraging technology to put exceptional care in the hands of every woman. So we see technology as a way to scale our platform. So if you look at wait times today to see specialists, they're very long. It could take anywhere between 12 to 24 months. In our platform, you're able to instantly get information about where you are at in your health journey, and then you're able to speak to someone within minutes and not months. And we're hoping that this is something that every woman across the country can use, leveraging our technology.
I think any woman who is in midlife health has been looking up for information about perimenopause and menopause. It's confusing. There's so many different, and they feel like authoritative sources out there. Going back to your points about how hard it is to access this kind of information, there is a fee aspect to part of this app. So the fact that there has to be almost a paid platform for women to get immediate and accurate healthcare access, how are you hoping that works to improve things for the larger audience? Maybe people who can't afford to do a paid version, but still want the same information. Like I feel like this is going to help push things forward.
Yeah, absolutely. So our platform is meant to be accessible. It's meant to contribute to the solution. Wait times to see a specialist is 12 to 24 months. We know that we don't teach menopause properly in our residency programs. When I'm an obstetrician.
Or in school, or anywhere.
Or I know, when I was in residency, I had 3 hours of training, and that was what made me do a fellowship. Family doctors are incredible, but they're stretched so thin, and it's really hard to keep up with the evolving literature and the evolving research in menopause. And so the fee associated with our app is eligible for healthcare spending accounts. It is covering the technology. So what we are truly doing is leveraging technology and AI in a way that we're going to be able to scale, hopefully, to every woman who needs care.
I want to thank you both for coming on today. Real pleasure to meet you.
Thank you so much for having me.
Blair Health, Madge Ruman, and Dr. Lindsay Sheriff. Good to have you here.
Yeah.
All right, now, a big milestone for the ultimate great white shark.